Hello, my name is Abigail Lannon Eves. I'm a certified nurse midwife and I'm the executive director here at Luz Birth Health Center. Why I love Luz. This goes back a long time for me, and I want to start with talking about why I love Albuquerque. I was born and raised here in Albuquerque. I never left Albuquerque, and I went to school here. I was a lifer at the Albuquerque Academy. I went to UNM for my bachelor's in nursing and my master's in nursing with a concentration in nurse midwifery. I feel very connected to the community here, and I feel very connected to the roots that I've set down here in Albuquerque, and I can't imagine actually practicing anywhere else. What makes Albuquerque in New Mexico a really special place for pregnant women and for birthing is that there's a very long tradition of midwifery care here in New Mexico. Midwives have been covered by our Medicaid system for a very long time. Out-of-hospital birth has been covered, mostly in terms of home birth. So it was a no-brainer for me to open a birthing center here in Albuquerque. We have nurse midwives throughout every community in New Mexico who deliver care, mostly in hospitals. And I think through that really rich history, it was really important to have a middle ground between home birth and hospital, and that's why I opened Luz. I also love the North Valley where we are situated. We have such a quaint and cozy space here that's a little bit off the beaten path, and I think that makes it feel a lot more comfortable for women when they're coming for their care here. And those things are all really important to the space that we've created. I love my staff and my board so much. Since our inception in 2007, I've been surrounded by people who really supported my vision of what a birth center could be. I've had men and women on the board who have consistently walked with me through lots of hard times and good times in creating this birth center, but who really believed in my vision and who really believed in making Luz not just one of the best birth centers in New Mexico, but one of the best birth centers in the country. And then I have the opportunity to work side by side every single day with this amazing group of women. I have 19 women on my staff now, and every single one of them is so amazingly passionate and caring and loving and empathetic, and they believe so much in what we're doing, and they believe in the care that we give to these women and these families to strengthen their families and to strengthen our community. And I feel like as an organization, as a business, we lead by example by showing how much we care about each other and then using that to show how much we care about our clients. I'm always so excited when I see a fresh new group of women and families who come to our orientation and are looking for something different for their birth. And when they sign up for care and they're trusting us to help guide them through this incredibly important time for them. Labor and birth to us is a really special event, whether it's the first one, the last one, number 5, it doesn't matter. We want to make this your birth, your special time, and we want to do our best to support that while also offering a very safe environment. We believe in evidence-based care, which is where we are going through studies, we are finding the experts who say this is what the recommendations are, and we follow that so that we can make this the safest place. And we try to help guide our families, if this isn't the safest place, to guide them with compassion and understanding if they have to go into the hospital, which is the place that they're usually trying to avoid. And so I love that our clients will walk with us or let us walk with them into those places and really trust us when we say, this is what we really think is best for you and your baby. I am still so in awe of women birthing their babies. I love watching women become mothers, again, whether it's their first time or their 5th time, every time they birth their baby. I love the look on their face when they see what they've done, when they see that baby come out. I love watching men become fathers and the looks on their face. And I love the community when people come back to us. I love seeing all these little babies that some of them are now 6 years old, some of our first babies, and to see them as kindergartners is amazing to me. Going out into our community and running into our families is so heartwarming. I think it's so important that women have dignity, respect, and compassion when they're giving birth. And if we can do that, even for a small number of women in Albuquerque, in New Mexico, in the United States, and even across the world, then we are changing birth one person at a time. And I think that's really important with everything that's going on right now in our country. Stronger women create stronger families, which in turn create stronger communities. And I think Albuquerque can be an amazingly strong community just because of our integrated healthcare system. So thank you so much for watching, and I look forward to meeting you.
Hi, my name is Elena Barris, and I'm a staff midwife at Luz Birth Health Center. I started at the birth center about a year and 8 months ago. And one of the things that I'm really grateful for is that all of the midwives and nurses at Luz accepted me as a brand new midwife out of midwifery school. And I think that it's only in such a supportive and loving environment where I could have developed into the midwife that I am today. One of the most amazing things about Luz is that there isn't really a line between the community outside of the birth center and the community inside the birth center. And so when I'm doing my shopping, or if I'm at the farmer's market, or if I'm at the climbing gym, or if I'm taking a yoga class, there's always an opportunity to see one of my wonderful Luz clients there and to check in with them and see how they're doing in their life outside of pregnancy or care. For me, as an out-of-hospital midwife, that's very special. I've always wanted to start my career as a nurse midwife in an out-of-hospital setting. And the reason for that is I wanted to train my hands and my eyes and my ears to work in a way that is with women. I think that the hospital environment is absolutely necessary in those cases where we need the higher level of care. And we have an incredibly special relationship with our backup physician and his team, Dr. Larry Lehman, and the family practice group at UNM. And so one of the reasons that I chose to work at Luz is because of that relationship and his ability to accept our transfers without any hesitation or question or delay. He trusts our skills as out-of-hospital midwives, and he's able to do a really smooth transition of care from the out-of-hospital setting to the in-hospital setting. With that said, I knew that I didn't want to work as a nurse midwife in the hospital. And so when looking for a job, I looked at all of those characteristics of full spectrum midwifery care, like gynecology, prenatal care, postpartum care, newborn care, and I wondered where I'd be able to practice all of those elements of midwifery care. And when I came to Luz, I realized that this is one of the most unique places in the entire country where midwives can both function out of hospital but also provide all of those elements of care. And so I feel really grateful for the ability to grow into a full-fledged nurse midwife and also be able to care for women throughout the lifespan.
Hello, my name is Susan, and I'm one of the midwives at the Luz Birth and Health Center. Before joining this remarkable practice, I was a midwife for 25 years, and I've caught babies in other birth centers, at home births, but mostly I worked in hospital midwifery. My life's work for more than 2 decades was building a large midwifery service, a very successful model of care that brought the benefits of midwifery to a majority of women birthing in hospitals. I am very proud of this work. But part of my daily course in that work was negotiating and navigating with very rigid hospital bureaucracies, having to fight for the simplest things that were simply the right things for most of our birthing circumstances. Midwives having to fight for mothers, for babies, and for families was part of our daily work. Midwives always having to fight. So when I came to my first staff meeting at Dara Luz, I sat in awe of the company of really passionate and talented women, all who were doing so many important things for the birthing community, the things we always had to fight for in my previous practice. Here at Dara Luz, there was no fighting for what was right. It was simply the culture. The option of water birth? Why, yes. Support for natural labor and birthing? Yes. No separation of mothers and babies? Yes, of course. Promoting breastfeeding? Yes. Truly helpful classes and important support groups for families? Yes, yes, I could go on and on. But please know that this is the first thing I love about Dara Luz. I am part of a dedicated and brilliant staff who all share in a common culture of simply doing the right things to support all aspects of birth and parenting. Another thing I love about Dara Luz is the physical space. It is my honest truth to share that I say a few words of gratitude each morning when I walk over the footbridge into our amazing space to start my day for my clinic appointments. Our center feels like a spa. Well, it actually was a spa before it was a birth center, and that nurturing and calming energy still vibrates throughout. Abigail's eye for simplicity, for artistic elegance, and for practicality makes our indoor space versatile and comfortable. And Melanie's talents in our gardens and grounds are something to behold. Every season there is something new to enjoy. I think possibly the most important thing I love and respect about Dara Luz is the educational resources and classes that we provide. Truth be told, you can't just sign up here to birth because you hate hospitals. There is important preparation needed when you decide to accept the responsibility to engage in an out-of-hospital birthing experience. We are committed to giving our clients the best information and tools to help them be as successful as possible in birthing naturally, in breastfeeding, and in parenting. And there is a human element in participating in our classes that is often the foundation in finding a community in motherhood and in parenthood, in familyhood. We have amazing classes and support groups here, including some of the best classes available anywhere to prepare for labor. We also have remarkable community of families here, families that connect through common interests in better birthing. Families who come from all points on a spectrum regarding levels of income and education, religious beliefs, cultures, and politics. And our families keep coming back to us. They return to our helpful array of support groups. They return for our reunion celebrations. They participate in our outreach programs and fundraising activities. This human connection, this community that continues long after the birth experience is so important. It is vital, and it often starts through attending our very special classes. Lastly, as sort of the cherry on top of the ice cream, I really love the old bell tower at Dara Luz. I love that we share news of the births up on the vintage marquee sign. I love it when families choose to ring the old bell announcing their baby's birth. I get chills when that old bell rings in celebration of a birth every single time. There is so much to love about Dara Luz, and I am very proud and very grateful to be a part of it all.
I'm Sarah, and I'm one of the midwives at Dara Luz, and what I love about our birth center is that we have a space that is unlike any other that I've ever seen or worked in, and we get to see birth in a way that most people don't get to see. It's really beautiful. We're really lucky that we get to help all these mamas and babies come to earth, so that's why.
Hi, I'm Melanie Yank, and I'm one of the midwives here. I'm also the clinical director at the birth center, and I just wanted to let you guys know why I love the birth center so much. I've always enjoyed women's health. I used to teach Lamaze classes and worked in labor and delivery, but more than that, we do something really special here that you don't see everywhere. We're with women and families through the whole process of pregnancy and birth and seeing them transition into healthy, happy families. And that's one of the most amazing parts of what we do here, and what I love the most is just seeing a baby come back in a few weeks or months and growing and gaining weight, and families learning how to just incorporate that baby into their family, and seeing the siblings all excited. All of these things are really amazing, and we don't see the same transitions in the other environments that I've worked at. So there's something really special about what we do here. I also love just the space that we have, and I have interest in landscape design and interior design, and so I did get to create the gardens around here, and that was really special because I believe that the environment that we're in really can affect our experience. And so I got to use all of the information that I researched in school to help create an environment that's really supportive for our families. And I can't imagine working anywhere else. And in fact, I don't want to work anywhere else. I just want to be here until they kick me out because I'm too old.
Okay, hi, my name is Donnie. I'm a new midwife here at Dara Luz. I've been here now for 2 weeks, and I'm really excited to be a part of the Dara Luz community. Also, I love that as a midwife, I'm able to provide care to not just the woman postpartum, but also the baby, so that I'm able to take care of both mom, baby, and really work with the woman and their families to provide the best care possible. So that's why I love being a part of this team, and I'm really excited to be here.
Hi, my name is Ruth Golar, and I'm one of the certified nurse midwives here at Dara Luz Birth and Health Center. What makes the birth center so amazing, kind of from my personal perspective and also from the perspective as a midwife, are a couple of different things. One is the holistic care that we provide, and in discussing holistic care, that also relates into family care. We don't just provide care to women through their transition during pregnancy, labor, and birth, but we also really keep in mind the transition of the newborn as well, and newborn well-being. That's a really different kind of mindset than what you might find in other arenas of healthcare related to childbirth, is that the newborn is often left out as far as thinking about the transition for that baby. And just as you're going to be transitioning during your care from who you are today to who you will become as a mother, you have a little person that's going to be growing inside of you who's also going to be making a really big transition. We're really going to help guide and educate you about what to expect when your baby comes, and that happens through the course of prenatal visits. It happens with some of our educational classes, and it also happens during your postpartum and newborn care here at the birth center. Within the state of New Mexico, as certified nurse midwives, we are licensed to take care of babies for the first 28 days of life. And so in some care models, once you've birthed your baby, you're sort of seen as one person and the baby's seen as a separate individual. And although that's true in our eyes, our babies don't really realize that they're separate people until they're about 10 months of age. And so our job here is really beautiful in the sense that we get to watch you and your baby make that transition together. See how breastfeeding's going, how's family transition, how's support, what kinds of things are you enjoying about your baby. And I think that's one element of our care here that really sets us apart from other midwife practices, but also other practices in which you might be considering for your labor or birth. In addition to that, we have an amazing community at the birth center. And I have to say, on both a professional and personal level, one of my favorite parts about this is not just seeing you during your prenatal care, watching you transition into a mother and seeing your baby come into the world, but it's also getting to watch you engage out and about in the community after your child has been born. And that's been one of the most kind of enjoyable moments for me, is when I see families out and about whose children are growing and getting bigger and get to kind of connect with them outside of the birth center. For our families, we get lots of great feedback too about how the community has really impacted their lives. Through the course of taking classes, you get to meet all these other families with some really similar takes on the labor, birth, and parenting process. And I've really enjoyed being able to see families come to us for care that have sort of little support and few resources, and really blossom into embracing the community at Dara Luz and moving that forward, where we have groups of moms who've been meeting for several years now, breastfeeding their babies together, enjoying parenting groups together, and really offering each other some amazing support. And I think in other care models, you're kind of divided up where you don't get the opportunity to build those connections. And I enjoy that in my personal life, going to the park or the grocery store, or being out and about doing things with my own family, and seeing our families grow their children is really beautiful. And the last thing I want to talk about is really the personal touch of care here at Dara Luz. So holistic care is provided. We help you connect to a community, but we also really provide individualized care. And what that means is that the visits that we have with you are more intimate than they might be in other settings, because we are focusing on the holistic you, not just what's happening in your pregnancy, but how's stress management in other parts of your life? How's your relationship? How's your partner, other children adjusting to your pregnancy, or bringing in another child to your family? But we also really get to talk about more specific health history and base it on what your personal preferences are to a certain extent. We do follow evidence-based guidelines and standards of practice, but we really get to have a conversation with you. And I think one of the things that is missing from modern healthcare is that often you go see a provider, the provider gives you the information, but you don't really get to have a back and forth conversation about what your preferences are. What's your background? What's maybe your spiritual preference? What have you done with previous children? What did you experience growing up? What are your beliefs around pregnancy and the spirit of this human that you are growing and developing? We really get a chance to talk with you more about that, and I think that that helps build a really deep bond and trust with your midwife, which is really important when you then come to the center for your birth experience. But it also really helps you feel empowered in your care, because it's a conversation back and forth. It's not just us directing the conversation or saying, here are things that you have to do, but it's really getting to know you and being able to adjust the care to your need. And I think in building empowerment for not only your birth process, but for raising your family, it's really important to be able to ask hard questions, sometimes have hard conversations with your provider, and at the end of the day to still feel like you were really heard and respected and all of that. So those are just some of the things that we offer here at the Birth Center that I think make us really unique. I hope you'll come check us out.